Yes, so basically it means those that are aged between 12 and 17 years old can line up for their vaccine as of the 20th of October. Many people are questioning whether or not whether or not they need to register first. But from what we understand from the Department of Health, you can register when you get to a vaccination site. This is a big move for government. We do know that across the globe, many countries have rolled out vaccine administering in younger age groups, and this was after the FDA approved the Pfizer vaccine for younger age groups. What's interesting is that the medicine regulator has approved the Pfizer vaccine, but only one dose, Kemen. So we know that in adults, it's 2 doses of the Pfizer vaccine or either 1 dose of the Johnson & Johnson. But in this case, the medicine regulator has told the Department of Health that according to their studies, it will be only 1 Pfizer vaccine for those between the age of 12 to 17 years old. Of course, this is government's attempt to get as many people vaccinated as possible, and this is why they're also trying to include the younger age groups because of their exposure and the exposure to possibly elder and more vulnerable groups. But let's listen to the Health Minister on this matter.
This service will start on the 20th of October to allow the necessary preparation on the EVDS registration system and also other logistical preparations. We believe that this will come handy as schools start their examinations, or some of them are already advanced towards concluding their academic year and are starting to prepare for the next academic year of 2022.
So do the children need parental consent?
According to the Acting Director General, the Child's Act does not need for one to have consent from their parents if they are of the age of 12 to 17 years old. And this is an interesting one, Clement, because many were asking how government plans on rolling this COVID-19 vaccine for this age group. I don't know if you remember, back in the day, you would go to school and then suddenly you would get a vaccine. So people are asking whether or not it's going to be the same situation this time around for the COVID vaccine. But the department's saying that you just need to go to a vaccination site and you actually don't need the consent of your parents because the Child Act says that if you are of a certain age and you want medical care or medical attention, you can go ahead and do so yourself. So they just need to get to a vaccination site and they'll be able to register there. Many people are saying, but what kind of identity will they provide? Because if you're 12, you don't have an ID number. But they've obviously made provision for that and they'll assist those who need to be vaccinated. Let's listen to the Acting Director General on that.
In terms of consent for children, so the Children's Act makes provision for children from the age of 12 to 17, in other words, not yet adults, to give their own consent for medical treatment. And there are provisions within the sub-clauses of the Children's Act that explain which children can give consent for what. So children do not need their parents' consent generally for any medical treatment, and there are specific guidelines on that. But parents can give consent for their children to get vaccinated. So it is possible for a child to go between the age of 12 and 17 to go for vaccination at a health service without their parents' consent. That's another reason why the school health program is not being used at this stage, because there's an agreement, a multi-party agreement between health and education and school governing bodies around how consent is given and how they are vaccinated in the school health program. And as I said, that's something we will deal with in a long and ongoing process later.